Hello, this is Dr. Stanley Lang, and welcome to this episode of Whole Person Health Tips and Chronic Stress Management. Today I'd like to talk to you briefly about a physical problem. As you know, the context for these podcasts is the treatment of people in a whole person way. That means paying attention to body, mind, and spirit at the same time as we try to pursue better health, and in my case, as I try to provide advice for better health. Today I'm focusing on a physical problem, and I'd like to tell you a story about a patient who has a very strong family history of diabetes. And part of the conversation that we had, she had this sense of inevitability that if she lived long enough that she was going to become diabetic, and that she just didn't have a lot of options because she had such a strong family history. And we'd already met a couple of times because her blood pressure had been elevated, and I'd been starting to instruct her on how to eat a low glycemic diet. And so I went into more detail, and the point that I wanted to make was that even in populations of people who have a very high predilection for developing diabetes, like a 70 to 80% probability based on their genetics, if eating the average American diet. If they eat a very low glycemic diet, the probability of developing diabetes is close to zero. The point being that even though we may genetically be predisposed to developing certain diseases, particularly diabetes, we can control how genes are turned on and off to a large extent by the lifestyle that we lead, including and especially how we eat and exercise. Also, the chronic stress reduction aspects of lifestyle management, which affect our emotional health, our spiritual health, and how all of that wraps into our physical health, are equally, if not more important, because those aspects control the chronic stress response in our body and in our mind. And so for this particular patient, I wanted her to know that she had a very good chance, as do you, if you have a genetic predisposition to diabetes, of not only controlling the diabetes pretty well by lifestyle, but actually preventing it if you are willing to make the right lifestyle changes, which include a very low glycemic eating plan, among other things. Now, I mentioned the idea of a whole person approach, and to be truly healthy, I believe that we need to pay attention to the physical, the emotional, the spiritual. Today we're focusing on the physical, that is the dietary choices we make, but all of that is important if we want to be, I think, truly healthy. I wish you well in your quest for health, and have a great day, and God bless.